Antibody screening. Okay, what's antibody screening? The test is used to detect antibodies, and the antibody screen are used for patients needing a transfusion, pregnant women, cases of transfusion reaction, blood and plasma donors. Antibody screening. Here, using patient plasma or serum, using patient serum against reagent of the red cells detect unexpected antibodies. Basically pasal antibodies ni kita akan pakai serum of the patient lah. Okay, red cells ni adalah reagent yang reuse, prepared. Kita buy from the known vendor. Okay, contoh macam apa lupa. Unexpected antibodies are found in addition to the expected NTA or NTB. Unexpected antibodies are results of red cell stimulation from transfusion ataupun hemolytic disease of newborn. Unexpected antibodies may be clinically significant ataupun from IgG ataupun from IgM. Okay, clinically antibodies usually is an IgG, react best at 37 degrees Celsius and AHG phase. Clinically significant antibodies are associated with hemolytic transfusion reaction and hemolytic disease of the newborn. Performing an antibody screening, the patient's serum is incubated with the screening cells. After incubation, the indirect antiglobulin testing is performed using AG reagent. This will detect any antibodies present in the patient serum. Okay. Now for the screening cells, screening cells single or pool of donor group O cells. However, single donor virus offer increased sensitivity. Why using screening cells of group O? So NTA and NTB won't react. Patient serum kita akan react cells group O lah. Kita pakai serum of the patient. Screening cells come in sets 2 or 3 vials. Each vial has been phenotyped for each antigen. 18 antigens are required on at least one of the vials. Maksudnya setiap vials tu 2 atau 3 kena ada at least 18 antigens lah. A, C, E and so on. Okay, antigens yang grup tu lah, grup yang pelik-pelik dia tu. Venus, Lewis, Cal, Kit, Staffy and so on. Okay, screening cells come with a sheet of paper called an antigram. Screening cells are already prepared of 2 to 5% RBC suspension. The antigram will list the antigens present in each vial. A reaction to one or more cells indicates the presence of an unexpected antibody. Kalau positif, reaction tu, maksudnya the serum patient is positive, react dengan sel, maksudnya dia ada antibody towards that antigen. Contoh dekat kolom NTK dia positif contoh. Maksudnya this patient ada antibody towards K antigen. Okay, macam ni lah bentuk dia. Tu antigram. Kalau ada 2 vial lah, 1, 2. Kalau 3 vial, 3 lah, dari 3 list. So at least one vial ada 18 jenis antigen lah. Dengan sheet ni we have to test setiap phase, immediate spin, 7 degree, AHG dengan control cell. Ni result dia lah. Alright. Characteristic of screening cells must group O positive, have representative of all important blood group antigens, be homozygous, be optimal preserved for antigenicity, obtain the cells from 2 or 3 individuals. Sikit lagi bagus lah. Kalau seorang lah ada sebut 18 antigen tu lagi bagus lah. Itu sangat dapat lah. Sebab kena increase the sensitivity. The technologies, the MLT lah, should be aware that some antigens demonstrate dosage. Okay. An attempt should be made to use screening cells that are homozygous for the clinically significant antigens. Just be aware that different strengths can occur. Homozygous antigen will react stronger. Heterozygous antigen will react weaker. Okay. Dia bergantung pada jenis sel lah. Kalau sel yang you dapat jenis yang homozygous, dia akan react stronger. Kalau heterozygous macam ni, dia akan react weaker. Screening cells may also contain low incidence antigen V, CW, and KPA. The presence of this antigen is not required for screening cells. Transfusion screening. Screening for antibodies is normally performed prior to blood transfusion to detect antibodies that react at body temperature 37 degrees Celsius. Although reacting antibodies are therefore considered significant and just cause interference when performing testing. The only important to remember concerning cold antibody is that they may bind complement if a person's body temperature becomes low. For auto control, test patient serum with their own red cells. Some labs may not perform. However, the auto control should be run with the antibody panel. The auto control is incubated with the antibodies name. If the lab use an auto control for the screen and it is positive, they may run direct antiglobulin testing to detect any in vivo protein. The auto control can help in determining whether the antibodies are detected against the patient cells or transfused cells. Okay, potentiator sama tadi, ada albumin, ada list dengan polyethylene glycol PEG. Okay, ada juga pakai enzyme techniques. Ni you boleh sini masuk enzyme code. Enzyme commonly used are fisin, papain, and bromelain. Papain is the most popular choice. Okay, the enzyme modifies the surface of the cells, digests the cell membrane, expose more antigenic sites, giving rise to a greater sensitivity to the presence of an antigen when serum is added. Reaction condition, pH of 6.5 is the optimum for papain activity and best at 37 degrees Celsius. Advantages of enzyme method. This technique allows the detection of some antibodies that will not react in the saline or AHG technique. Its greatest use this detection of antibody. As this is the second most immunogenic set of antigen, it is worthwhile procedure untuk research testing. Some antibody capable of causing an in vitro transfusion reaction may be detected only by use enzyme technique. If the tube technique is used, the cells can be carried through anti-hemoglobin test, giving an ever wider sensitivity. The tube with papain carried through to a papain is the best method for detecting anti-hit antibodies. It also can detect the absence of rouleau, abolition of frozen phenomenon, disability operation, and speed. Okay, now what is the disadvantages of using enzyme method? It will not detect antibodies directed against certain red cell antigen, as these antigens are removed or destroyed by the enzyme treatment. MNS antigen, Duffy group antigens are removed. This means that enzyme technique is not a satisfactory screening procedure on its own. The control used in enzyme method, the interpretation of an enzyme must be done by comparison with controls. The positive and negative controls are system controls. If they don't work, the test is invalid and must be repeated. The auto control detects auto antibodies and provided a baseline for comparison of positive results. The next is a saline technique. This is designed to detect IgM antibody. For example, for NTA, anti-NTM, anti-LEA, EB, LUA, LUB, and NTP. IgG antibody that should not be detected. Sebab dia buat dekat temperature lah. Using it's for blood grouping, screening for complete antibodies, a range of temperature. First stage of an AHG technique for incomplete antibodies. Okay, for the precautions, first, the optimal ratio of serum to cells for antibody coating is between 82 and 120 to 1 ratio. With this in mind, the cell suspension and volume used must be critically assessed. 1 volume of 5% cell to 4 volumes of serum gives this ratio. Cells must be suspended in saline. Glucose citrate buffer has an anti-complementary effect because of the citrate, so cells must be washed. Fresh serum should be used as many antibodies bind complement. This may be missed if serum. Also, plasma should not be used for 3 reasons: anticoagulants, and fibrin clot, and fibrinogen that can promote rouleau formation. Reaction time must be adequate. Reaction temperature is at 37 degree ataupun room temperature. Centrifugation at the reading step is important. Okay, next is the potentiator, low ionic strength solution. The rate which antibody antigen binding occurs is governed by the ionic strength of reactant medium. Decreasing ionic strength will increase the rate of binding of antibody. At 3% saline, a significant shortening of antibody cells being occurs. An incubation time of 10 minutes of 37 degree is sufficient to give an antibody binding reaction equivalent to that of a 30-minute technique with normal saline. Okay, next is a bovine albumin. Use bovine albumin with concentration of 22%. Too high concentration of bovine albumin will cause rouleau formation. Rouleau functions introducing the zeta potential. Okay, so what is the limitation? Very effective in detecting antibodies. If negative, then the cross-match should be compatible. However, dosage may weaken a reaction. Antigen may not be present on screening cells. Patient may have a passive ABO antibody. Here is an example of screening cells.